السلام عليكم ورحمة الله وبركاته. أهلا وسهلا بحضراتكم in case of the week 15 on our channel 4D Passion. This is a case referred to my center for third trimester anomaly scan. We will review the case images and cine lobes. The case has normal fetal growth, cephalic in presentation. The stomach lies on left side with normally seated liver. The heart is markedly displaced to the right side, markedly dextroposed, with hypervoluminous left lung. The left lung is hypervoluminous, extending into the right hemisthorax, and the heart is markedly dextroposed, abutting the right ribs. Again, this is a contralateral location of the heart against the stomach, with markedly dextroposed position of the fetal heart. Here is also was noted an umbilical vein aneurysm. It may called also umbilical vein varix, with a single left pulmonary artery and a single left pulmonary venous return from the left lung. And here is our cine lobes. You will notice the marked displacement of the heart and the homogeneous left lung. No significant encroachment on cardiac chambers. And here you will notice the three-vessel view and the outlet view of the heart, with no appreciable anomalies. And here an important cine loop showing that the diaphragm is intact, with complete separation between abdominal viscera and lungs. You will also notice here the pulmonary venous return, single pulmonary venous return from the left lung. And you will notice here also the normal flow direction at the three-vessel view. So the findings are completely agenetic right lung with left lung compensatory hypertrophy and the marked displacement of the heart into right side, abutting the right ribs, with intact diaphragm and in situ liver and stomach, with umbilical vein aneurysm. The lung agenesis incidence is extremely rare. Risk of chromosomal anomalies is extremely low. Risk of non-chromosomal syndromes is very low, and the prognosis is better in left lung agenesis than right lung agenesis. That is our case here, unfortunately, probably because of a greater degree of heart and mediastinal displacement with corresponding distortion of blood vessels and bronchi in right lung agenesis. The etiology of this anomaly is unknown. However, more than 50% of children with pulmonary agenesis have associated congenital anomalies that involve the cardiovascular, GIT, skeletal, and genitourinary system, with most of the limb and the spinal anomalies occurring ipsilaterally to the pulmonary agenesis. Differential diagnosis. Main differential diagnosis is congenital diaphragmatic hernia. That is the case where the differentiated from lung agenesis by the absence of abdominal viscera in the thorax, and that one of the lung field is totally missing and absent in lung agenesis. And scimitar syndrome, on the fourth chamber view, the right lung is smaller than normal, which determines a shift toward the midline or right hemithorax of the heart, mesocardia or dextrocardia. The inferior right pulmonary vein or both pulmonary veins are absent and replaced with a collecting vertical vein not visible on this view, which drains abnormally into the inferior vena cava. You would notice this accessory extra vein in the umbilical situs, in the abdominal situs view, where you can see the aorta to the left and IVC to the right, and here you will notice that there is a third vessel lying almost in between them. This is an important point to notice on ultrasound. And here is the main differential. This is a case of diaphragmatic hernia, our case for the past week, case of the week 14. You will notice that there is a remnant part here of the right lung, but actually in this case of right lung agenesis, you will notice this just the spine and the heart, and there is no right lung tissue at all. With hypervoluminous left lung that looks homogeneous with no appreciable abdominal viscera, as these bowel loops in this case of diaphragmatic hernia. And here is a case of scimitar. You will notice that there is a single pulmonary venous return from the left lung, and the heart is rather mesocardiac, centrally seated in position. This is the main important differential diagnosis. Management: no need for karyotyping. Delivery in a tertiary center with a cardiorespiratory facilities is recommended. Rarely neonatal intubation is needed due to significant tracheal shift. Take-home message: in unilateral lung agenesis, main differential diagnosis is congenital diaphragmatic hernia. The absence of abdominal viscera, a chest intact diaphragm, and a completely missing lung favors lung agenesis. Do not automatically consider significant cardiomediastinal shift as congenital diaphragmatic hernia. There is other differential diagnosis. Please review the case of the week 14 on our channel, congenital diaphragmatic hernia, to better differentiate both entities. Congenital diaphragmatic hernia has high risk of chromosomal and non-chromosomal syndromes, while the risk is very low for both in lung agenesis. Kind regards and see you soon. Dr. Amr Farouk.